Hi, it's Kal again from anesthesiacoach.com. What I'd like to talk about today is a principle of practice management that was brought out in a very famous book, a business book actually called The Goal by Eliyahu Goldratt, an Israeli physicist. One of the most common problems in dentistry, as well as many other businesses, is that the business owners, in this case us dentists, get their information from other dentists and dental consultants who were dentists or dental consultants who were practice management personnel. Many of the most successful businesses gather their information and ideas from other businesses. In this particular case, Goldratt has written a book called The Goal, a novel actually, a fictional story which teaches businessmen, and in this particular case a factory, how to improve output. Output in a dental office essentially is production. How can we improve production? How can we put more people through the office successfully and with high quality? Well, a dental consultant I know recently I spoke to, I talked about helping our office. I asked him what his system was, and the first thing he said was, I increase marketing, get you more new patients. But if you read The Goal, you realize that isn't necessarily the case. In The Goal, Goldratt talks about the theory of constraints. In other words, what is the roadblock that's preventing production from increasing? What he calls throughput. In our case, in a dental office, throughput is quite simply how many patients come in, get their service, and come out. What is that roadblock? Many dentists think the roadblock really in their office, the constraint, is the lack of new patients. Well, we don't realize that roadblocks appear in very many different forms. For example, the phone. We have two personnel here usually, and the phones are ringing off the hook in some days. Are there patients trying to come through? Is this the first roadblock? The number of operators we have, is that holding us back? The number of doctor hours. Many doctors don't realize that their limited hours limits the access. A friend of mine brought in a consultant once, and the consultant told him he should market more. But what the consultant didn't realize is my friend is booked out already 2 months, solid. How will marketing help him produce more revenue? It can't. So in our seminars at anesthesiacoach.com, one of the seminars we discuss the theory of constraints and how to apply that to dentistry. Where can we identify the roadblocks in our offices? Where can we eliminate roadblocks and increase production? It isn't necessarily the most common item on the list, i.e. new patient flow. Very often there's a hidden roadblock somewhere in our system that if we eliminate it, we can increase production significantly. In our full-day seminar, we talk about the goal and how we can apply the principles of this book to our dental practices. What we don't realize is there are hidden roadblocks throughout our office, the phones, the waiting room, our practice hours, the number of doctors available, so many potential roadblocks, constraints that hold us back from getting production. Too many dentists think that it's just a lack of new patient flow, but in reality it could be many different things. So look at the schedule below and see what seminar is most appropriate for you, and I look forward to seeing you. Thanks again, it's Kal from anesthesiacoach.com.